Patients very often do not want to come into the doctor's office these days, particularly with COVID and limitations in travel. So the real question is, is there any other way that we can evaluate patients with peripheral arterial disease? And the answer to this, honestly, is yes and no. Certainly, we offer telemedicine consults if need be, where we can initial consultation with a patient or a patient's family member to help assess what's going on and get a general sense as to whether the symptoms are due to peripheral arterial disease and something that might be appropriate for us to evaluate. If there's no wound, this is really quite effective because we can, sort of start therapy initially. However, at some point with peripheral arterial disease, it's very, very important to just come in and see the doctor. And one reason is we need to get the appropriate diagnostic testing, generally an ultrasound, to identify exactly where those blockages are and how severe they are, to get a sense of what the best method of treatment is, whether it be medical therapy and exercise or a requirement for some sort of minimally invasive outpatient procedure to restore blood flow. At that time, it's also very important to assess the wounds, see what that risk is, whether this is a wound that seems to be a chronic stable wound, a wound which is of concern and might be deeper and potentially pose risk for infection in the bone, which will require more aggressive treatment. So certainly there are opportunities to provide initial consultation, by phone, via telemedicine, but at some point, depending upon what that shows, we're going to want to meet and greet and examine you as well.